Hello there, Red State Revolt back again, and this time I'm talking about the excess death reports that have come out here towards the end of the year and even into the new year. And one of the reports that caught my attention was one that was released by CNN. Of course, whenever CNN publishes something on the healthcare front, I take a look at it because it's usually riddled with errors and issues. And one of them was about most COVID deaths in excess, or at least the excess deaths were mostly due to COVID. And I've just found that interesting. It was sort of an assumption, and whenever there's that narrative or that assumption out there, it always gets me thinking, and it reminded me of a conversation that I had very early on with some of our medical professionals where I work. And one of the questions that I asked, because we work in a setting where we treat a lot of patients that are end of life or on hospice, and specifically hospice patients are those that are in imminent death, end of life. They are going to die in the next couple days up to the next couple weeks. And so the question that I asked was, what happens if they contract COVID-19 or they test positive, but they either have very mild symptoms or they're really not showing symptoms, and they test positive? Are we considering that an excess death? And I have emphasis here on the word excess. And the answer to that question that I received was yes, because COVID-19 hastened their death. Okay, so the follow-up question to that was, how is that in excess then? Meaning, if they were going to die anyway within the next few days to the next few weeks, how could we say that was in excess of what was already going to happen? And the answer that I got was sort of a dumb blank stare. I don't know, that's just the way that it is. Of course, when I get that kind of an answer, it makes me dig a little bit deeper into what's really going on. Now, there's a number of problems with the concept of excess deaths, and one of them, out of the two that I want to talk about, one of them, and this is the challenge in doing some of this content and videos, is this just opens a huge can of worms. You go down a rabbit hole and these videos can go on and on and on, so I want to keep them at least somewhat succinct so I can get some points through in a short period of time. But part of it was around the accuracy of the COVID-19 tests, and it took until pretty much the end of the year. This particular report by the World Health Organization was published on December 14th, finally admitted that there was a problem with the PCR test that's used to detect COVID-19. I have the links to these articles in the description. This particular link is there. It's a little bit easier to read if you're not a medical or healthcare professional. I also have a link to the actual World Health Organization document. But the basic problem, and it's funny because they put problem in double quotes here, and that's because the problem is with the way that the test cycles, how many cycles are being used. And I've worked with HIV/AIDS testing and test results there, and looking at a patient's viral load is a really important part of determining whether or not they're positive. In essence, the viral load's telling you how much of that virus is in the person's body. In some cases, you may have the virus, and I have relatives that work in healthcare, and I bet some of them have some really nasty viruses in their system right now, but that doesn't mean they're positive for that virus. They could be fighting off something like MRSA, really nasty virus that they picked up in a hospital, but they're not positive for it. Okay, and so it's important to understand that that test was highly sensitive, and the number of cycles that was used was set too high, and it was giving too many positive results, and that's the basic fundamental problem with that test. Okay, and so that relates to some of the people who may have died testing positive and then saying that that was an excess death when it really wasn't. The other problem was encouragement to choose COVID-19 as the underlying cause of death. That's UCOD here, and you may remember that Dr. Erickson came on very early in some news reports, and he was vilified and questioned and maybe even blacklisted to some extent about his portrayal of being pressured into choosing, or I use the word encouraged to choose COVID if that test came back positive even when there were no symptoms. There was even the CDC release, and I've highlighted it in yellow here, that shows what they said, probable or presumed cases. Of course, the doctor can make their own judgment, but as Dr. Erickson was telling you, they were encouraged to put down COVID as the underlying cause of death, even when they didn't clinically think that it was. So that leads me to what really is the excess. And I'm not going to say that there weren't COVID deaths. That's ridiculous. I'm not saying that. There absolutely were. But the articles that are out there are saying it's due to COVID mostly. And so I want to challenge that a little bit and say, is it really though? And part of what we're hearing is how many drug overdoses we've had, how many suicides we've had, how many homicides we've had, and other issues. And so what I was able to do is go out and pull some information that was produced at the beginning of the year, well, at least up until May, which is as of the time of recording this video, when I could actually get the data and present it. And what we have is information from rolling 12 months. So this is total deaths over a rolling 12-month period, just to be clear. And the light pink here is when COVID sort of started, and these escalate with this rolling 12 months. So as a new month comes off, the oldest month comes on, the oldest month rolls off, and you can see that you start to see this really steep increase, and this is all drug deaths. Okay, so what I was able to do is take that information, put it into Excel, and sort of forecast out what it would look like if we took the increases that were taking place at the beginning. And remember, this is pre-COVID, so to be fair, there was already an increase occurring pre-COVID. And then we have some idea or some trend that we can put in here. And this is actually what I'll call a conservative trend, because if you look at what happened between the year ending April and the year ending May, there was really a doubling, as far as I can tell, between the year ending April and May. And I'm only accounting for 1,000 increase in those rolling 12-month periods, right? This is a very conservative estimate. And you can see how much that is causing an increase here in the number of deaths. And we look at it. And so the excess that I want to take then is, what was it like before COVID? What was the year ending look like? And the difference between the 81,500 and what the forecast would be for 137,500. Now, forecasts are notoriously bad, so I don't want to put a stake in the ground and say this is what I actually think the forecast is going to be or what the numbers are going to be, but this is a very conservative estimate. On the high end, you could be looking at, if you're looking at a huge increase where we got 2,000 more deaths in that rolling 12-month period for each month that came on, you're looking at a significant increase. And again, if you take the excess between what it was at the start in that ending 12-month ending period and what it could be by December, you're looking at a difference of 106,000 out of the supposed 300,000 excess, right? And that's just drug deaths. That doesn't take into account all of the other potential deaths that could have occurred, excess deaths that could have occurred. Now, what could have caused this? Well, one is there was a lack of access to treatment. So if the treatment centers weren't open, or somebody wasn't able to get, I'll say, diagnosed as a drug abuser and seek help and treatment, they continued down that path and overdosed. Possibly there was just an increase of use. That could have happened. People may have been depressed. There may have been other environmental, social issues, of course, going on, being on lockdown, whatever it is that increased use and access. The last could be that there was a decrease in drug traffic monitoring altogether, that it's possible our law enforcement, the authorities looking at stopping drug trafficking, were not as productive as they were pre-lockdown and during the outbreak. That's certainly possible. Then there's some other contributors. Okay, so let's look beyond opioids for a minute, or even beyond all drugs, because the total that I had also included cocaine and other substances. But what it didn't include was alcohol abuse. That was not included in there. Suicide, self-harm suicide, was not included in those numbers, and I did dig into as most recent that I can find. And the problem is, most of the suicide numbers that are official are from 2018. We don't even have 2019 numbers yet. If you go to CDC Wonder and you look at their data set, it still has 2018 data on there. Even if you find a website that says they have 2020 data, there's an asterisk that says it's from 2018, not 2020, and it's really difficult to get those numbers. Murder, homicide, and I'm going to get to that in a minute. I'm going to show you something from localized data set, and then just overall decrease access to healthcare in total. How many people died because they weren't able to get access to healthcare when they needed it? Right, so those are the additional factors, even just beyond the drug overdoses. So what I was able to do, and I'm looking hyper-localized, I'm going to look at Cook County, the Chicago area, and then Illinois, and what I was able to dig up, and this is from January 4th, so just a day ago that this was published, at the time that this video was recorded, and the medical examiner's office has 8,192 deaths this year in the county. They typically have about 6,200 a year, and so they're 21, almost 2,000 above what the average would be. Now, if you look at the homicide rate, so if we go down here and we look at, there was 970 homicides in 2020. That's a 43.7% increase. right? And remember, that's just Cook County. That's not the rest of Illinois, and that's not any of the other cities or states. Think Baltimore, Detroit, Minneapolis, Los Angeles, and so on. And there were also a record 875 gun-related homicides, which broke the previous record of 838 that was set in 1994. If we look at the opioid-related deaths, they've said what I said, that there was a rising number. Of course, how could they miss that? Those numbers have actually been reported, and I'm going to show that in a minute. Of the 1,599 confirmed opioid overdoses this year, there are still 450 to 500 toxicology reports that have not come back yet. So at most, we could see another 500 opioid deaths on top of the 1,600 that have been reported so far. That's incredible. So that surpassed the numbers from the year before, which was 1,277 deaths. All right, so let's dig into a little bit of these numbers just to show you where I'm getting at with some of these percentages. So what I just showed was Cook County, but if we go and we look at the state overall, and the way that I was able to sort of pull this was I logged on to the state's death reporting page in December, and I just kept that page open. I took a screenshot of it and then refreshed it after the first of the year, and I was able to get that PDF to come through and take a look at Q1 and Q3. This is Q1 and Q2 compared 2019 to 2020, and you'll see that there were 482 more opioid overdoses comparing Q1 and Q2 of both years. That's a 48.6% increase. Now, if we go then looking at Q1 and Q3, there is some good news here. And in Q1 and Q3, there was a 532 death increase, but that only was a 33.6%. I say only because compared to the 43% trend that we were heading towards for the year, that's actually kind of good news. So it's possible, if we go back a couple slides and you were able to look at the trend that was happening with the bar charts, that it looks like, at least in Illinois, it topped off. So you don't have those bars going up by 1,000, 2,000, 3,000 every single time. It looks like it topped off. Of course, that's just Illinois. We don't know if that's going to be the trend for the rest of the country. Illinois is not having as big of an opioid problem as other parts are. It's still a problem, but not as big as other states. One thing I'll note, though, keep in mind, this does not include the 500 pending reports. All right, and that's just for Cook County. That doesn't include the other counties, the larger counties in the state, like DuPage County, for example. I couldn't find how many pending reports they have, but I assume they would also have some. It wouldn't be just Cook County. So at worst, you could see this number go up to 1,032, which would be a huge increase. That'd just be unbelievably huge increase in that particular period of time, just for the state of Illinois. Last part that I'll go into is, let's continue the discussion here. So I'd love to hear some feedback. What other sources did I potentially miss? Unfortunately, I just don't have the time and resources to go through every single city, county, and state data to find it. I'm trying to extrapolate from what happens in Cook County in Illinois into other states. So what are you experiencing in your geographical area, right? What is it that you're seeing in some of the information and data that's coming to you? All right, that's all I got. Remember, subscribe, click that bell, try and get some more information heading your way. Thanks for listening.